The US healthcare system continues to face compounding challenges. Not only are administrative costs consuming over 40% of total hospital expenses, but recent studies show that up to 30% of all healthcare spending may be considered wasteful. At the same time, there's growing pressure on healthcare organizations to improve quality metrics like STARS ratings, which carry real financial implications. As organizations balance cost optimization, data modernization, and quality improvement, AI and workflow intelligence are emerging as powerful enablers. I'm Zena, a tech writer, a Spatio Media incubator, and a contributor to publications like Entrepreneur and The Sociable, covering all things AI. Today, I'm thrilled to be joined by Amir Azarbad, 10Pearls Healthcare Managing Director, and Peter Hesse, 10Pearls EVP and Security and Tech Leader. We'll explore the evolving state of healthcare, the role of AI in driving operational efficiency, and how tools like 10Pearls Decision Configuration System, also known as DCS, are helping organizations modernize decision making while supporting governance, transparency, and measurable outcomes. For those who don't know, implementing AI-driven solutions like DCS can play a pivotal role in addressing these challenges. DCS platforms enable businesses to set up decisioning criteria in a unified interface, enhancing governance and transparency across various applications. By streamlining decision-making processes and tracing workflow management, DCS can contribute to reducing administrative burdens and associated costs. Amir, let's start with a broader view. What are your thoughts on the current state of healthcare? From rising administrative costs to the pressure of meeting quality benchmarks like STARS ratings, what are some of the most critical challenges payers are facing today, and how are they responding to the use of AI, automation, or data-driven strategies?
Well, Zena, that's a really good question, and thank you for having us on. This is an exciting conversation. A lot of the state of today's healthcare is all around reimbursement and the Medicare Advantage, and trying to figure out how to lower the overall cost of delivering care to patients. So let's take two sort of critical talking points here. First, let's talk about the STARS rating. A STARS rating of an insurance company determines their reimbursement. So for a health plan, if they have, let's say, 40,000 Medicare Advantage members, if they are able to move their STARS ratings from a 3.5 to 4, that could mean millions additional reimbursement dollars. So you're talking $20 million, $30 million. You can move it up another half a point. You get an additional $8 million to $10 million. So it's a real big focus. The challenge is it's really hard to do. And I think the payers are very much struggling with that. You also have a new administration. And anytime there's a change in Washington and new administration, new policy, that has a significant impact on the state of the payer market, specifically because a lot of the reimbursement for the government population will come from the federal government. So you put those two together, and then you have a backdrop of AI and all the payers trying to figure out how to do administrative cost savings. How do you get better at automating? How do you reduce your manual workforce? It is a very interesting market at the moment to try to figure out all those missing pieces to the puzzle. I would say the state of the healthcare market economy at this point is a kind of wait and see. So for a little bit. They're waiting to see what the administration does. They're trying to figure out what they can do with AI. And we'll talk a little bit more about specifically some of the challenges they face with implementing AI solutions, looking at machine learning and the language models in a little bit. But at the end of the day, the healthcare market is kind of a wait and see approach at the moment to see what the new administration wants to do with the Affordable Care Act, and that will have downstream impacts across the payers, the providers, the pharmaceuticals, the tariffs on the pharmaceutical companies. Those could have some impact. So there's some real macro-driven economic things that are going to significantly impact what the healthcare market's going to look like in 6 to 12 months.
It's incredible how quickly things are changing, but they do seem to be constants as well in the backdrop, as you pointed out. Like obviously a lot of things happening with the financial aspect. There's more pressure on healthcare institutions and pay providers. And as well, there's obviously this huge push to drive operational efficiency and lower administrative pressures while they're also battling things like staff shortages. And this actually is kind of going into my second question, which is how do you perceive the role of AI and data aggregation in enhancing clinical decision making and operational efficiency?
AI has a significant opportunity to automate and make life a lot better for the payer, right? From a day-to-day operations perspective, automating tasks, we have this term in the industry about next best action. If you think about what the payers do within the ecosystem of healthcare, a lot of their focus is around making sure they can move the needle a little bit. So if a member or is a high cost claimant, for example, someone that's generating $50,000 worth of claims cost a year, the goal of the payer in that scenario is let's make sure that they don't go to $60,000 next year and they don't go to $70,000. So a significant opportunity there is for them to leverage AI, leverage machine learning and languages and algorithms to figure out all the signals from all the noise. There's a lot of data, as you can imagine, that gets generated across the spectrum between providers, the payers, and as individuals, right? We all have our wearables and devices, and it's tracking, it's got a lot of information. Trying to figure out how to get all that data aggregated and then putting a language model on top of it that will then determine what the next best action is for that member to help keep costs down. That's kind of the biggest opportunity from a clinical care perspective that I think AI can play. From an operational efficiency perspective, the payers are looking to reduce their administrative overhead and administrative costs. There are ways to automate tasks that in the past have been manual. So I'll give you a couple examples of what that looks like. When a member is diagnosed with, let's say, diabetes or asthma, there's a case manager that gets assigned. It was a very manual process. There would be a manager that would take a look at the case. They would have some discussions, and then they would determine who's available, who's not going on vacation, who's got the next 30 to 60 days open, doesn't have a workload that's too intensive. They can really pay attention to make sure that they are standing by their member. All those things were administrative overhead where they would have to hire people to do that. Now with automation and with AI, those can all be automated. It doesn't have to be intensive in terms of administrative costs. The second part of that coin is the payers get a lot of members calling in to their customer service lines for different various issues. Either it's billing, it's asking a question about a letter they receive, an authorization. There's a ton of different scenarios. In the past, there used to be different units and all the folks that are answering your phone calls, et cetera. Now by automating what type of issue you got, where you need to go, a lot of it is actually done through apps and digital media so that people don't have to call customer service or care centers to get their answer. So significant opportunities, some that they've taken advantage of. There are some bigger issues though around data aggregation that are hindering their progress and how much they can truly use AI to automate and make everyone's lives easier and more efficient, if you will.
Obviously the digitalization of data and moving from physical papers to having everything on the cloud, having everything within apps, it's only natural that there would be a lot of concern around security. Healthcare is one of those things that people hold very closely to their chest. It's not something that people like to take lightly at all in terms of any leaks or even sharing with third parties. And Peter, this question is actually for you. With the integration of AI and data aggregation tools that Amir has just been talking about, how are industry players ensuring the security and privacy of patient data in compliance with regulatory standards? Obviously, these regulatory standards are some of the most stringent in the world, and they have been since the Hippocratic Oath was created, you could say. But I'd love to hear your insights around that.
Yeah, it's really an interesting time in the healthcare space, right? Because you have people that work in these organizations that are being exposed to new things through AI in their personal lives. Everything from their, Amazon Alexa or whatever else, to assistants in their pocket and things that are on their computer, various co-pilots and chat GPT and everything else. And they're saying, why can't we do this at work? Why are we struggling with this? And it's exactly because of those compliance requirements, those fear, right? These heavily regulated organizations, of which healthcare is probably the primary. They have, very strict penalties for if you go out of compliance, if you accidentally leak data. So There are strategies that are happening. They're evolving on a day-by-day basis to meet the needs of the organization as they look to get more efficient, as they look to improve their star ratings. But they're also wanting to, not get, run afoul of the law. So part of it starts with doing risk assessments, really looking within your organization to identify, what is the information we're going to give to these kinds of systems, and what is the information that may be retained by them, and understanding, the risks associated with that, whether those are compliance or security risks. Of course, we're all familiar with like the standard methods like encryption that have been used and really popularized since the advent of HIPAA and high trust standards. But there are new technologies, one of which is called homomorphic encryption. What homomorphic encryption allows you to do is allow you to calculate on the data even while it remains in an encrypted state. So these AI systems that are able to take advantage of homomorphic encryption standards and be able to do AI learning and matching and things like that against encrypted data, those are the ones that are going to have the best success of making sure they stay in the in the lane with compliance. Organizations are putting in their own governance policies, their own frameworks. They're assigning heads of AI governance and putting policies in place, creating use cases of where AI can and cannot be used, what kinds of data can go into each of these kinds of systems. So, perhaps you created clinical decisioning system and you say, this is the kind of data we can share with that system, but we can't share this other sort of data, which is maybe too private or has too much of a risk associated with it. They have to look at all these systems and understand, what is the data retention, what is the security policy of the organization or system they're sharing it with, and just make sure that they understand it, because things as simple as retention policies, those AI systems sometimes remember data longer than you want it to.
Yeah, absolutely. They can be cheeky like that, we could say. And actually have a couple of questions off the back of that. One of them is actually around your thoughts about, the general pattern you've been seeing. Because you talked about, healthcare institutions setting up their own data governance frameworks. Just a quick question around that. By and large, how do you find that the general crowd tends to cope with that? Do people tend to do it quite well, or is there a long way to go for the majority when they're setting up those data governance frameworks?
It's interesting. It is a little bit of the blind leading the blind at times, because you have organizations that are very risk averse jumping into new technologies. That's not their specialty. But what they are doing, the leaders in this space are bringing in experts. They're bringing in organizations that have experience in this, that have been doing AI technologies in the past, and really learning from and trusting their experiences to help them set up, um, you know, both the governance as well as the technology to work in their best interests. So where they work with some outside firms that are maybe a little bit more nimble and experienced than they are in the space, those are the ones that are being more successful.
That's great to know and reassuring as well that while all these rapid changes are happening, people are going to the right ports of call to make sure that they're doing it right. My second question is actually around transparency, because you can have all the right guardrails in place, but particularly when you're dealing with, very concerned patients and very concerned practitioners as well around the whole data aspect, they need the proof. The proof is in the pudding, as the saying goes. What is your advice around showcasing, that you're being compliant, that you're sticking to these protocols, that you've got the right frameworks in place? How can organizations best be transparent around those security aspects?
That's a great question, and we could do an entire webinar on AI transparency at another time. Transparency in AI is a really important thing that you're hearing from a lot of organizations, both standards bodies and compliance organizations. You're hearing this from the Gartners and Forresters of the world as well. That you need to build transparency into these systems, and for healthcare, that's even more required, because of the fact that if you're ever in a situation where you treat one patient differently than another, you're going to face not just regulatory and compliance wrath, but untold numbers of lawsuits and concerns and things like that. So there's a real need when you're leveraging AI to understand how that AI works. Part of the way that AI works is that you don't have to understand it, because if you knew how it should work, you would just write the code yourself and do it that way. And so how do you balance these things? The way you do it is that you really expose what you can through those decisioning processes. So, clinical AI tools, for example, that are making some sort of decision on behalf of, to determine the next best action, to determine care or things like that. It essentially has to, like you would in your math homework, write out your work, right? Describe the steps, why it's taking them, and sort of what is the mathematics, or what are the reference points that it's pointing to in order to make those decisions. That's part of the transparency. And you can show things like scores and the importance of one variable or value over another, which ones influenced the path that it took, and really just raising the awareness of that. It has to give explanations, essentially, of how it did the work, and how it came to that decision. And also how, if you had done different inputs, it would have come to a different decision. Having all of that visible to the end practitioner is important. And the other thing, and again, in AI tools, is there, sort of the uncertainty estimate and the confidence level. Like being able to model out, how much of that confidence level you're willing to adjust to maybe encourage a different decision choice. Again, the transparency needs to raise that up and share that, so that it's not all happening within a black box, but instead it's very out in the open. It shows you a pathway of how it got from A to B. And that also increases confidence in the system, so that, everybody from the healthcare payers to the practitioners to the inpatients are confident that they're getting something that it meets their expectation.
Absolutely. And that black box point is so important as well, because a lot of people still see AI as this black box that they just can't, like an enigma that they can't work out. So I think that's also where a lot of the fear mongering is happening, not from the developer's side, but from the healthcare providers and from the patient side as well. We see it as this thing that just can't be understood, yet we're inadvertently or indirectly cutting our lives in its mechanical hands to an extent. Just talking about, what these tools can do, Amir, going back to you, I would love to know about any experiences you've had when implementing AI solutions and how they've led to measurable improvements in patient care and cost management. This is now going into the walking the walk aspect of using these AI tools. I found some interesting case studies around it. For instance, Johns Hopkins University, they developed a machine learning system for sepsis called Targeted Real-Time Early Warning System, also known as CRUISE, which they used in 5 hospitals over 2 years. Across almost 10,000 cases were retrospectively confirmed with sepsis cases. The AI tool managed to diagnose, I think, about 82% of patients quite early on with the sepsis. So that's a pretty incredible number to have. But I'd just love to know as well your own experience and insights with these tools and what they do for the patient care value and addressing administrative pressures.
I think what the providers are doing is amazing. Having the ability to look at all this data and being able to diagnose things earlier. I got a couple of good friends that are dermatologists in the Chicago area, and they're talking about being able to see melanoma cells long before that their eyes would see. So the application on sort of the clinical side of it for the provider is going to be amazing, and it's going to be life saving for sure, right? Figuring out how to get it done. Focusing in on the payer side, let me share with you a couple of sort of deep dives into what I mentioned earlier around the high cost claimants and like a holistic view where these AI tools are really applicable. So one of the things that we did for a large payer was build this longitudinal care management algorithm, using all the data that they had, trying to determine signals from noise. And the idea here was looking at patterns, letting the machine look at the patterns and figure out what are the factors that move people from one category to the next. If you're $50,000 a year, What is it that happens that moves you to 75 and then moves you to 100,000? Is it financial factors? Is it the fact that you can't get your prescription because you don't have the ability to get a cab to go to Walgreens, CVS, or wherever and pick up your prescription? All that data was put into these algorithms and let the machine learning look at previous use cases, look at the future, and be able to determine from all the noise that these pairs get with all the data coming in, what is it that's going to be a tangible set of next best actions that are going to really truly change and impact someone's care, and then being able to look at that, bounce it back against the current population, and then identify members that are susceptible to being those that are going from 50K where their health's going to deteriorate and go to 100,000 because they can't do one or two things. And so being able to be proactive and letting AI really take that solution and all that data and determining that information has been very helpful for the payers as they manage to keep healthcare costs that continue to rise year over year. The second part of it is more about a function that the payers do within their care management units. I don't know how many folks know this, but once you become a member of a payer, they have a unit within their clinical unit that looks holistically at all the data that they're getting and are able to determine and manage your care holistically for you. For them to be efficient, to be effective in doing that, they need to really try to aggregate a lot of data together. So one of the projects that we did for a large payer was putting together a holistic aggregator of data. So this is not just all the clinical data that exists within the insurance company, such as claims data and authorization, but immunizations, looking at socioeconomical factors for where they live within their zip code, looking at history of the doctors they've seen, the kinds of conversations they've even had with the insurance companies. You'd be surprised how many people just call into the general hotline asking about diabetes or asking about asthma or asking about a friend. Like if you can take all that data and holistically put it together, then what you can do is put AI on top of it. And the way we solutioned this for them was the staff, the nurses, the clinicians, they would come in, open up this holistic snapshot of a member dashboard that they had. And let's say there's 30 to 60 members that are within their care or preview at that moment. It then, based on analytics, tells them who's the first person to contact, then who's the next contact. And not only just who's the first person to contact, but when you contact that person, what are you trying to do? What is the conversation you should be having with them? It shouldn't just be, hello, like you got diagnosed with diabetes, but it could be to the point where do you need a glucometer? Do we need to send you one? Or do you need a ride to pick up some prescription? Or, all those types of questions. Being more intelligent, it would take hours for the clinicians and nurses to sort through all the notes and taking a look at all the information that exists. Now they come in the morning and their work queue is optimized based on AI, and they're able to figure out who the next person they should call and what the next best action is. And that's a significant automation that's really helped the insurance companies be more effective, keep costs down, and at the end of the day, impact the lives and care of the member.
It's incredible to hear, this groundbreaking technology, these innovations that are literally changing and saving lives. And in healthcare, it's like the tiniest little details and connecting those
Hmm.
those dots that, at first sight wouldn't be logically connected that can make or break patient care and then ultimately the responsibility shouldered by the payers, for instance. Keita, just to go back to you, as Amir's talked about all these really incredible solutions and what they're doing to transform the world of healthcare, I'd like to know how you assess the effectiveness of these solutions, particularly when it comes to reducing administrative burdens. What metrics do you suggest using to evaluate their impact?
So obviously, I think there's a lot of places where you could put measurements to it and really show. Some are going to be very clear just thinking about it, and others are going to require measurement and looking at. Give you one quick example, like patient care guidebooks or fact sheets or whatever else. Using those to translate into multiple languages is something that traditionally costs a lot of money, takes a lot of time and whatever else. Something that can be done just so much faster. It's like a no-brainer. It's busy work essentially that AI can automate. But speaking of like specifics, and I did look up a couple of numbers, and case studies with some specific organizations. One was looking at nurse administrative time and how much time they were spending on, what Amir talked about before, deciding who is going to take over, the scheduling side of things, like who's going to care for what and for who within a hospital. There was one organization that showed that when they use an AI-based scheduling tool, they were able to reduce the amount of administrative time for those nurses by over 6 hours per week, which is almost a whole business day worth of time, in just a 300-bed hospital. That's how much time that people are spending. So you can look at those times, measure that administrative time. Another good measure is looking at billing errors and sort of the callbacks of somebody reaches back out because their bill was wrong, or you have a dispute and related to a claim. That's tangible. You can actually measure that. One organization that's put in an NLP based billing system found that they spent 32% less time dealing with billing errors when they had that NLP system looking at their bills before they went out and sent them out. Cost optimization is another big area that you can look at. Again, getting back to scheduling and really the predictive staffing models. So understanding these are probably going to be the busy times for our medical system. That was it the day of July 4th, or things like that, where you know that there's going to be a surge in need. Using AI models to predict when you need larger amount of staff and who and in what areas. They were able, organizations are able to see and measure their costs of overtime and unexpected, having people stay late and things like that. One healthcare system saved over $2 million over the course of a year by using a predictive staffing model within their hospital. So, things again that are harder to measure but worth looking at. Burnout. Burnout is a real struggle in the medical field, and it's hard to measure because not everybody really raises their hand when they're in a burnout, but everybody in the industry knows about it and talks about it. Using AI to reduce some of that administrative burden, the busy work, the stuff they don't want to be doing, that's going to help reduce burnout levels. Patient experiences can be improved if you can be more efficient, if you can be quicker, if you can bring things to the forefront faster, get them access to whatever it is on their phone, on their watch, or whatever else. People like being able to get that information faster. Using AI will help them get it faster. And then, getting back to what I talked about before, compliance, right? When you have maybe a system that's looking over your compliance, you can actually save money on your total compliance costs. When you know that, you've got some AI driven, record retrieval, or, AI that's looking at your retention policies and making sure you're not running afoul of your various compliance rules. So all of those are ways I think organizations can help measure the impact of AI in their organization.
Yeah, there's so many touch points that these tools are addressing, as you said, burnout, maximizing the patient care, reducing cumbersome administrative tasks that no one really wants to be spending like 6 hours of their week doing. And obviously, this all hinges on a really, really interconnected system. But in an ideal world, I mean, we could just put in a new tool into an existing digital ecosystem, call it a day, and everything works fine and dandy, right? But that's not the case. And Amir, this question is for you, but I wanted to explore more what the challenges are around adopting AI technologies, whether that's the DCS or other tools, and how you've helped to address these challenges to ensure successful implementation, whether that's, navigating interoperability, or ensuring that there's no bias and hallucinations with these tools, as well as cost concerns about investing in the tools in the first place and making sure there's that ROI. It'd be great to dive into those challenges.
No, absolutely. And this is where it gets interesting, right? And Peter alluded to this a little bit. When it comes to AI, the trust is key. You don't want to look under the hood and see what's going on. You just got to trust that it's doing it. And when it comes to payer, that means if you trust AI to do what it's doing, it could make a decision between approving a service and denying a service. And I can assure you that no payer ever wants that notoriety in the in papers that says they just inadvertently denied an authorization for services for someone who really needed a transplant, who had a serious condition, who needed a surgery or something. So the challenge with AI within healthcare is just that, the adoption of it. All right, we talked about the providers earlier being able to diagnose melanoma earlier by using AI. What if it goes wrong? What if you false positive something early on, and someone goes through all this chemo and all these other procedures, and then it wasn't the case? That's the real reason why AI adoption within the healthcare environment has been really slow, because they realize what happens is like and death, right? It could mean a complete difference in people. So it's not a reason to not embrace change in technology, but it's definitely a reason for them. And what we've seen with our clients is it's always a cautious approach to AI. There's a whole conversation we can have around the fact that data aggregation behind the scenes needs to be done better, the quality of data that the payers collect before AI is even going to be effective. And I would say there's a lot of investments that are going on in that area right now within the pairs to really start focusing on their data, aggregating it, figuring out how they ingest data, how they prepare data for consumption, so that once AI can get its hands on that data, then they can hopefully be able to make better decisions, more accurate decisions versus the bad decisions, if you will. With that said, what we've been doing with a lot of our clients to sort of move this process forward is we always say we start with the end in mind. We sit down and talk to them and say, where do you want to go 1, 3, and 5? What's success look like for you? What are you trying to measure? Let's prioritize the work that you want done sooner that we think can be easier. So I talked about the administrative cost savings of reducing the manual intensive work. Those are things that we could do internally that could save you significant amounts of dollars going forward. It's using AI, giving you exposure to AI. And maybe that's where we start to focus on first, aggregating, automating workflow. And then as you move forward, you can sort of automate the authorization process and the determination process based on the clinical data. But that's kind of down the road for you. So we start with the end in mind. We roadmap what needs to get done. And then what we do is come back to them and say, the easiest part of this is technology. We can put a lot of AI, we can a lot of tools on it. But as I said, let's get your data right. Let's figure out your processes are optimized. Because if your process isn't optimized, you're not going anywhere. Now let's make sure your people understand, because change is hard, and large organizations like payers have thousands of people that have been doing this job for years. And you don't want to create this tense environment where people are afraid of AI. AI can really be a tool that can augment their day-to-day operations at work. You have to manage that change. So we put all of that together. We meet and talk through the data people process, and then ultimately get to the point where everyone's on board. We've got the right processes and right data, and people are engaged and interested in it. And then you start implementing the technology. And we've seen significant success doing that to take away some of the concerns that people have with AI as it exists. But at the end of the day, there is a real hindrance or roadblock to adopting AI within healthcare, because it's a difference of life and death in some cases if the bad decisions made.
Thinking about, embracing change and getting everyone on board and hopefully overcoming these hurdles, it would be great to look towards the future horizon, like what's coming up, what's exciting. You talked about like what's further down the road a little as well, looking further down the road and having that forward thinking mindset. So, Peter, on that note, I have my final question, which is around the future developments in AI and data analytics you foresee, and how are organizations preparing to leverage these advancements to enhance healthcare delivery? What is your team doing, for instance? Would love to hear.
So let's start with the second part of your question and then get back to the first part, which is, what are organizations doing now? I mentioned earlier that, part of it is about bringing on talent and outside folks that can potentially help them, look towards the future with AI. So a lot of organizations, I think, if they don't already have somebody that's a chief data officer that's looking, that's somebody that's in the AI space or an innovation space or something like that, they're looking to fill those roles. They're looking to hire people that understand these technologies and get smart about it so that they can be, part of the move towards the future. I think organizations are spending a lot more money on technology, on infrastructure. Some of this is in cloud infrastructure, but some of it is also in physical infrastructure. buying these GPUs and these special purpose systems that can help build and train these AI models faster. It is generally, if you're spending a lot of time building and rebuilding your models, it is to some extent more cost effective to buy your own hardware to do that than to do that in the cloud right now. Those cloud, massive computing infrastructure are still very expensive on an hour by hour basis. Um, Organizations are spending money on sort of test environments, sandboxes where they can basically duplicate existing systems and add AI to the mix. They don't want to upset the apple cart with their existing platforms, but they need to clone it and see how AI can improve it and impact it and test it and make sure that, again, they have that transparency, they have that confidence, they've got that governance in place so that when they want to then pull it live, they can. A lot of organizations just don't have that test infrastructure now, and that's what they're spending money on is how do you evaluate those AI models outside of your production environments. So what does the future then hold, right? Like I think I can think of at least two things. One is again some of the things we already mentioned, but the future I think that we're going to start to see is these AIs, kind of looking at organizational workflows across an organization and maybe identifying or even just self-healing those workflows themselves, understanding where the bottlenecks are in the organization and how they can be overcome, what are those escalation points, how to draw them. We're going to start to see AIs used to move these things faster because unlike, again, the older models where, you're waiting for a call back or you've got a piece of mail in somebody's box or you're waiting for an email approval or something like that. The AI doesn't have to wait for that. It can push and push and push until it gets the answer it needs, whether it's a positive or a negative, and move that forward. And if there's a break in the action because somebody's out on leave or some system is down or whatever else, those systems may be able to heal themselves to intelligently understand the organization, how the organization works, how things flow within the organization, and be able to push things forward. So that's something I think we might see. And then of course the holy grail, which Amir mentioned briefly earlier, is truly this multimodal, um, true foundational change to healthcare and how we look at healthcare, which is to combine everything we know about the patient and everything we can learn about the patient, right? So whether it's imaging like X-rays and MRIs, genome studies that we have, blood tests, social determinants of health, of course, the existing immunization records, healthcare records, everything that we can learn about that person, putting those all into a model to be able to affect better outcomes faster. That's what we're all looking to achieve. We do believe that AI is going to help us get there because it's going to help us make sense of that data that right now is just too much for any one individual or even one team to really get their hands on and understand. So as we get these massive amounts of data, looking at large patient populations, I believe that we're going to be able to see real improvements in health across the world.
And hopefully we get to that future sooner rather than later, for better care for everyone.